So I'm Dr. Rhys Beynon. I'm a consultant in emergency medicine at St George's Hospital, and I was invited to talk at the conference today about my experience, essentially, after filming with 24 Hours in A&E, the Channel 4 documentary that's just recently been on TV. So I started off the talk just by talking about the practicalities, really, of how a company makes this program, setting up 100 cameras in a department and sort of essentially filming everything that goes on in the department 24 hours a day for about 6 weeks. And sort of the process that goes along with that, sort of the consent process and how robust that needs to be. And just about how having a media sort of company in your department actually, initially you'd think it would be a really negative thing, but how actually positive that is, because obviously they come with their communication skills. They have money and they have cake and they have smiles, and they'd ask me, you know, how I was doing, and just little things like that, sort of that feel-good communication that a media company can bring to a department, and how easily it is for us to forget in emergency departments, actually just in the morning, just to say good morning to our colleagues, or you know, ask them how they're feeling, how their weekend was, and we sort of just go straight into, well, you know, there are 14 patients waiting to be seen in majors and 2 patients in Rhys's that need to be seen, and you've got 3 on the way. So just that little insight really was sort of really just changed the mood of the department for those 6 weeks, and I think as a department we really missed that. The feedback I had was all super, super positive, and actually what the public and patients want to see is they just want to be treated by what they perceive as being a human being, because after all doctors are human beings as well, and part of being compassionate at work is allowing yourself time to reflect on your own feelings and emotions, and being intimate with yourself emotionally almost, which then allows you to be sort of available for the patients that you treat. The outcome has actually been really positive for me, from colleagues as well as, you know, patients, and, you know, sort of social media feedback, and even people on the street just saying, you know, how nice it is to see a doctor come across that way on telly. But I don't suggest that we take 24 Hours in A&E to every department in the sort of the UK for you to do that. So I sort of talked about ways of maybe that you as individuals could just reflect on how you are, you know, in work, and maybe how you deal with compassion and situations that may be emotionally difficult. So certain tools is just maybe just sitting back and reflecting on, you know, why you went into medicine in the first place. What was it that was important to you? What was it that you know, when you were a medical student, what made you excited about going in, or what were the things that you really enjoyed doing? Because it's so easy for us to forget what we get out of work, really. And people are so passionate about the NHS, and, you know, there are so many positive tweets on Twitter about, you know, how amazing the NHS is. And sometimes it's just worth sitting down for 5 minutes and reading some positive words about the work that we do. Other more sort of structured ways for looking at reflection in practice in medicine is something called the Schwartz round, which is a situation which can be led in a department, supported, really needs to be supported by sort of from a chief exec point of view, and it's sort of run with the whole trust in mind, and it's a safe place essentially where 2 or 3 individuals might talk about a difficult situation that they've been in, and then the audience are encouraged to reflect on maybe situations that they've been involved in as well. And sort of it's a closed session for an hour's period that should be sort of where staff should be encouraged to go to sort of during their work time. But I think the one thing that the program, being involved in 24 Hours in A&E, really showed me, and what the feedback is from patients, is that patients love the work that the NHS does, and love the work that we provide as healthcare providers. And it was just really, really nice just to have that feedback of, you know, just people saying, you know, you're awesome or you're amazing. So I just want to share that, really, and that's what sort of my last slide was to the audience, was to say that actually every individual in that room, or every individual that works in the NHS, every individual in the world is awesome, and you just need to allow yourself the humility to acknowledge that you are awesome and the work that you do is awesome.